Hi, thank you. Thank you so much for having me, and thank you very much for your time and for everybody for being here, especially with this kind of serious and sad topic. But I'm going to try to share with you information I've learned over the years, as well as personal information on this topic. And it is a steep learning curve, as you know, if you've been through it. Loving a pet is easy. And I think living with animals is easy in general. The hard part comes when you have to let them go. And I try to add up all of the years that I've had joy, and then the maybe 6 months to a year that I've had to make these decisions and provide this care. And it really adds up to a win-win situation if you think about it. We can do a lot for these animals when they're sick, but does that mean we should? And that's really a lot of what I want to touch on today, because the decision-making process is the hardest. And as a vet tech and a friend and a sister and a daughter, these are the questions I get most. And I try to provide the best care that I would provide to my own pets. And a lot of that involves home care, because the hospital is no place for a sick animal, is what I always say. There are difficult decisions to be made. There's also the cost of care. And with animals, this is something that we need to consider in every decision that we make. And that adds into the burden, that adds into the stress, and that does add into the decision making. And we'll talk a little bit about that. And also support and self-care, because once the decision's been made and our beloved family members no longer with us, we need to take care of ourselves. And that's going to be incredibly important moving on as well. So a little bit about my experience professionally and personally. I've been working in emergency and critical care and veterinary medicine for over 25 years. I've worked in general practice as well. So not just the ER setting, but as well as, where you would go for your vaccines. And I've worked with feral cat rescue, which is a whole different ball game, because those guys really don't like to be treated. In general, at work, we average about 5 to 10 euthanasias a week. Personally, we probably as a clinic do a lot more, but I'm personally involved in. So this is something that obviously I'm involved with a lot of, and it never becomes routine. And I can probably speak for the rest of the veterinary professionals. We take each euthanasia very personally. I have probably euthanized and loved about 25 pets in my lifetime. So I feel like, honestly, that's the best learning that I personally get. The other thing is that my views have changed over the years. Ways I've treated my pets in the past are not how I would treat them now, and I'll talk more about that. And what I've really learned is that we worry when we make the decision to euthanize a pet, that it's too early. We worry that we're somehow cutting their life short, or we could have had more time. And what I found purely clinically and personally is that that's pretty rare. I find it in my setting, usually it's often the opposite. We waited maybe a little too long. So some general things that need to be taken into consideration when we're talking about animals is, it's kind of all in a name. We as time goes on, it seems like animals are becoming more part of the family and more important. We see this in the pandemic particularly, but this was happening pre-pandemic. We call them fur babies, pet parents. I see online shirts that say dog mom or cat mom on them. And this is how we feel, this is how we treat them. But I think that it kind of overlooks that we're dealing with an animal. And we really need to keep that in mind. We consider them children, we consider them partners. I literally call my dog, who you've seen in some of these pictures, my partner. And when I went through a divorce, he literally became my partner, and I call him that. but I need to remind myself quite frequently that he is a dog. He is not a human. He lives in the moment as a dog, particularly the pit bull type tend to do, or the lab as pictured in this graphic here. We know this going in. Every time we adopt an animal, we know they are probably going to die before us. Their lifespan is not as long as ours. There's a veterinary ethicist, if this topic in general interests you, named Dr. Bernard Rollin, and he works out of Colorado State University. And I have been a follower of his and read everything he has written like a rabid dog. And I just find him quite brilliant. And he's written one paper that changed my life. And I talk about it quite often. And it's about geriatric cats. And I will speak quite frequently about my dog. However, I must disclose, I am 100% cat person. I always say my dog gets to stay because he acts like a cat. So cats are where my heart is. I love dogs, but I'm a cat person. And the article he wrote is about geriatric cats. And there was one paragraph, and I'm going to paraphrase here, where he said that cats aren't waiting for their grandchildren to graduate from college. Cats don't take pleasure out of children getting married or having babies. That's not their goal. That's our goal. And when we think about their lifespan and their quality of life, we really need to take that into consideration. And I just found that so profound, that, you know, longevity is not their goal. Having a good time is. And I need myself to consider these things quite often when I'm dealing with my own pets. And then the other thing is, you know, euthanasia, you know, it's obviously a sad topic, but when we think about the root and pulling apart the word, it does translate into good death. And I can tell you, and we'll talk more about the process itself, but with all of the euthanasias I have been a part of, that is truly the case. These are animals that death is a good thing. Otherwise, suffering would have been the other option. So if we're lucky, and sometimes we are, sometimes we're not, and it's a gamble we take, that this is a geriatric animal that we're talking about, an animal that's in its kind of end stages of life. Hopefully, we've been able to spend years together. Again, not always the case, but if we're lucky. We've enjoyed health. We've enjoyed love. We've enjoyed, you know, cleaning up. We've enjoyed going for hikes. And things may start to fail. And we need to be aware of these things. Mobility, arthritis, and spinal issues. This is true for cats as well as dogs, not just big dogs, small ones too. Continence is going to potentially become an issue. Loss of urine and bowel control, which can certainly affect the bond that you have with these animals. Cognitive, animals can get confused. They get kind of dog and cat versions of Alzheimer's, which will show in different ways with their cognitive function kind of failing on them. Senses will start to decline. Vision, my dog can't see very well at night at all, and we have to take a flashlight out, otherwise he walks into things in the dark. And he's totally lost his hearing, which in our case is a good thing because fireworks and thunderstorms ran his life out of phobia, and he sleeps right through them now. So the loss of hearing has been a good thing in our world. Appetite may start to decrease. They may become picky about eating or not be eating as much as they were. There's a saying in veterinary medicine, I assume it's in human medicine too, but I don't know much about human medicine. And we always say age is not a disease. Age is not a disease. However, it needs to be considered into the equation. It's a complication. Certainly, older animals don't heal as quickly or heal as well and have other concurrent health problems. And our expectations need to be realistic. Cats live an average of 15 years. And some cats will live longer, some cats won't live that long. But when we're thinking about deciding on treatment and euthanasia and all of these thoughts, that needs to be a thought in our head. That if you get 15 years out of a cat, that's great. And dogs in general, smaller dogs do tend to live longer than larger dogs. So I just have some kind of stats on there that are not cut and dry. You find different numbers everywhere. But in general, these numbers do kind of jive with what I've seen over the years. So some things to consider when we're deciding about treatment of these animals, because before we even think about euthanasia, we need to start thinking about, is this treatment something that we want to pursue? If there is a treatment option for whatever's going on with these guys. And the thing to consider is, are there other issues that are going to affect their quality of life? If a dog needs, some kind of surgery, if they have cancerous mass, and it's a 13-year-old dog and he already has, significant hip degeneration, is that something that you want to put that dog through? You need to take the hips into consideration as well as whatever else is going on. Do they have cardiac issues? A lot of older animals will have kidney issues as well. You also need to really consider, and I always consider, the physical aspects for larger dogs. I tend to, at this stage in my life, I'm a pit bull type person. They usually run about 50 pounds. And I tend not to look at a dog bigger than 50 pounds for me, because I want to make sure that when their mobility fails, I can be of service to them. So, if a 100-pound dog needs its leg amputated, you need to think about, am I going to be able to help this dog afterwards? The dog's going to have trouble with mobility, at least in the beginning, and is going to need, if I live on a 3rd-story apartment, is that doable? If there's spiral staircases, is that going to be a problem? And these things need to be considered before decision making. For cancer, when we're talking about chemotherapy and radiation for animals with oncology, I mean, it's amazing what we can do with these guys. You want to ask about side effects, potential side effects. Sometimes with some radiation therapy, they can get burns, dermal burns, like humans can as well. The other thing about animals is they need to be anesthetized for radiation. They don't lay still in the tube so much. So that's going to require anesthesia. And if they're on a regimen of 3 times a week, that's anesthesia in an older animal 3 times a week. And these are things that need to be kind of thought about. The number one thing in my personal life with my personal pets that I kind of live by in these decisions is their temperament. Are these the kind of pets that are going to let me treat them? Is treating them going to affect our bond? Is it going to decrease their quality of life? The dog in this picture here, I'm going to speak quite frequently of her in this talk. Her name was Marley. She's no longer with us. She was 3-legged and lost her leg when she was 4 months old due to a growth deformity. So she was always 3-legged. But her problem, her whole life, was behavioral. It had nothing to do with her being 3-legged. She had anxiety. She was incredibly dominant. She had trouble being around other dogs and some people. And she was very limited in what she would let me do to her. Nail trimming alone could be kind of an ugly event. So when Marley started to fail, I really needed to take that on to consideration, what she would let me do and what would be realistic for her personality. And then there's the financial component. And this is something I hear a lot of. I actually was at the doctor and was talking to the nurse there about this as well. And she had put a dog to sleep. And it was an older dog that needed its leg amputated and it already had mobility issues. And she said, I could not afford the surgery. And I said, listen, I said, even if it was free, the surgery, you had all the money in the world. Think about that 13-year-old large dog. its life expectancy, which it's already surpassed. And if you had done the amputation, the other joints are going to be more taxed and have more problems. And if they're already failing, is this really going to be a financial decision? Put money out of the equation. And we talked for a couple minutes, and she said, I probably would have still chosen to euthanize. So I'm just trying to say, don't make it about finances. Take everything into perspective, and you'll find that oftentimes finances are not the breaking point. The breaking point is actually the quality of life of your pet. So there are three parts that we really kind of want to think about. I like to break things down into easily digestible parts. And there's the pre-euthanasia part, which is kind of the end of life care and decision-making process. There's the euthanasia, the act itself. And then there's the post-euthanasia. And you can see here, the only stress really on the pet is going to be in the pre-euthanasia part. So the rest is really about us and our recovery. So when we talk about pre-euthanasia, we want to talk about kind of a hospice type care, palliative care, which just means reducing pain and suffering at home for terminal disease. Some people choose this route for their pets. Some people choose to euthanize before they get to this point. I don't know that either one is wrong. I think it depends on the pet and the family. The entire family needs to be on board with this if they are involved in the pet's life. Pre-euthanasia, maybe we have a diagnosis and we know what we're treating, and we know that this is the end of the line. But a lot of the times, especially in veterinary medicine, we don't have a diagnosis. Either, financially and temperament-wise, we couldn't get there, or whether we tried and just still couldn't get there. There's a lot of times where you can throw everything financially, emotionally, temperament-wise, and still don't really know what's happening with them. And assumptions need to be made in those cases. But if they're older and it's kind of been a progressive chronic thing, we can kind of see the end of the line. So for instance, an older cat with kidney disease, I often say, if you have a cat that gets old enough to get kidney disease, that's a good thing. Then that means that cat has usually led a great life, a long life. And with kidney disease, we start to see, some minor changes with them, maybe a little bit of a loss, decreased appetite, or increase in drinking and urinating. And then as kidney disease progresses and we have different treatments, we see the progression of it, and we can kind of know where we're headed with these particular animals. Sometimes we don't have a diagnosis and things are failing, and we really need to take things like temperament and age into consideration. And the picture I have in this particular slide is kind of a real clear demonstration to me of two different cats with two very different personalities. The gray cat, the larger gray cat, was a feral cat that I brought inside. And he was wonderful. He was friendly, but I was not able to treat him for anything. I could not get medications in him. He reverted kind of back to his feral self. So we had an agreement that I would not do those things to him, and he would continue to love me, and we would have a relationship. The smaller tabby cat in that picture, his name was George. He was raised as a bottle baby. I had him for 17 years. He never spent a minute outside or being feral, and he would let me do whatever I wanted to him, literally whatever I wanted by myself at home, take blood, whatever. So therefore, when George got sick, I was more inclined, the cat that would let me do things and had that temperament, to do more things to him. When the gray cat, his name's Waffles, when he started to have a decreased appetite, I decided I would be okay not knowing what was going on with him. And I would assume that he either had, the old cat things, renal disease or some kind of cancer. He was about 16 years old, and he was losing muscle, he was losing weight, and I could tell that he was in end stage disease. I didn't know what disease it was, but I didn't need to know because I couldn't treat it. So I would try to mix some medication in while he was eating, some pain medication. When that failed, I euthanized him at home where he liked to be. So that's what I mean by having a diagnosis or not and being okay with it. I always say, don't chase a diagnosis if you can't treat it. And I knew with Waffles, I couldn't treat it. So why put him through the diagnostics just so I would know? And there's a financial component there for me as well. There are a lot of different quality of life scales that you can look for online. I'm going to give you a bunch of good resources for other information, but they're everywhere online. This is kind of the more popular one, this quality of life scale here. There are other calculators that you can look as well. You can also make your own, and I'll talk about that. But it's really important to keep track of what's happening with these guys. It's very easy to get caught in the moment, I guess, as they would, and not really see the big picture. And for me as well. So we'll talk about some of the aspects of this. And the number one for me is pain. And people always ask me, how do you take care of sick animals that are dying all the time? And my answer is always pain meds. It's always been my answer, and that's my answer for home care as well, and with my own. It's pain meds. And if the pain meds can help, then we can all sleep. So you want to assess them often for pain and talk to your veterinarians and your veterinary professionals. They're going to be your best resource for everything. If they have a painful or assuming it's a painful condition, just assume pain is there. Cancer is painful. Organ disease can certainly be painful. The other thing to just keep in mind is that even if you are treating them for pain, that doesn't mean the pain's gone. So keep assessing them for pain and having your veterinarian, again, with all the telemedicine and the record, you can record a video and email it to your vet. You don't even have to necessarily bring them in, and your vet can potentially give you some advice. Some considerations also, again, getting these pain meds in. With Waffles, I knew I couldn't get any medication in him, so I couldn't treat him for pain, which is what opted me for euthanasia. Side effects, a lot of these medications can have side effects. Financial, again, these are expensive medications. And other conditions. Are these pain medications going to aggravate some concurrent conditions they may have? I do want to just mention the pulse electromagnetic therapy. This is one therapy that I use. You can see I used it on Marley, that's my three-legged dog, and my current dog, Eli. The reason I used it on Marley is because it was the therapy that she let me use. Like I said, she wouldn't let me do much, but she was always game for the loop when she was sleeping. So it can certainly help, and for a variety of different reasons. I use the loop on Eli as neck pain. He also suffers from some GI issues, and I will use it there as well. Other pain options, again, don't forget anxiety with these guys, especially if they had it when they were younger. It's going to be worse when they're older in general. And with pain also comes anxiety. So keep that in mind as well. Joint support is going to be important and pretty easy to do. Things like bedding, make sure they have nice warm bedding. You can massage them, that's if they'll allow at home. Acupuncture, Eli, you can see there, he does love acupuncture, and for us it is a doable thing. It may not be for every animal's temperament or finances. Marley would never have allowed that, so acupuncture wasn't an option for her. Steps to get up to their favorite spots. If cats eat up high, make sure that they have steps. Cats love heat too. And the other thing to consider and to ask your veterinarian about is using steroids. I have used them in the past on animals. It's, short term makes them feel better in a lot of cases. It depends what it is. It won't be for cardiac, but for some cancer pain, and some other pain. It can make them feel better for a short term. Appetite, I think appetite's a great indicator of quality of life, particularly in dogs. Pain can lead to decreased appetite, so it may be an indicator that pain is happening or the disease process itself. Make sure you are treating nausea if that's a problem, and talk to your vet about anti-nausea medication. Don't be afraid of table food. When we're talking about end of life, you know, it's game on, if you ask me. Cat food for dogs is my favorite, and one my go-to in the clinic for animals for dogs that will not eat. Baby food for cats or dogs. I find the Gerber ham is the stinkiest, and cats love it. The cheaper food is often the better. And to keep in mind, puppy and kitten type foods often taste better. They have higher calorie and fat content. So it's usually one I'll grab too. Hydration and hygiene, if they're not eating as well, if they're vomiting or having diarrhea, that's going to lead to dehydration or potentially make dehydration worse. So you may want to talk to your veterinarian about giving them fluids under their skin or sub-Q fluids. It can be done at home if the animal has the right temperament, but talk to your vet about it. If it's something that you're willing to do and your pet's willing to withstand, it can certainly help. It's not worth it if you have to pin them down and sit on top of them for it. Loss of bladder and bowel, you know, we hate to admit it, but it can get in the way of our relationships. It is frustrating when you wake up and your living room is covered in feces and urine. It doesn't make us love them any less, but it certainly is not a great way to wake up in the morning. I can tell you that personally. And some animals do get upset by it. Eli, when he has an accident, it upsets him. And I always tell him he's a good boy. So maybe he's doing it on purpose at this point. The other thing to consider is if their mobility is a problem, is that animals can get pressure sores, much like humans. So you really want to make sure that you have soft bedding for them and that you encourage them to use it. Their elbows in particular, from laying on hard floors, can kind of get pressure sores that can actually get infected and cause other problems. When people use diapers, you want to just think about urine scalds. They can, you know, if with urine sitting there, it's very acidic and can potentially burn their skin. So maybe ask about potential barriers you can put on there, like Desitin, but talk to your vet about those. Mobility is certainly going to be an issue getting older. Slippery floors. You know, my dog has problems with the hardwood floors, so I have rugs, like runner rugs all over, so he can get up on things and kind of get around. They make slings for hind end support for dogs that need a little help in the back end. You can buy a fancy harness online, or you can take one of those cloth reusable grocery bags. And if you cut out the sides that don't have the handles, it makes a really nice sling with handles. Ramps or steps getting up to their favorite places or up into the car. Nail care is important when they're having mobility issue, cats and dogs. If you have one padded bed and the dog loves it, try to make it mobile. So if you're in the living room, you can put it in the living room. If you're in the bedroom, you can put it in the bedroom so they can be with you. And the other important thing is you want to make sure for cats, there's a litter pan on each floor. You don't want to make an arthritic cat have to go up or down a flight of stairs to use the litter pan. And litter pans with low sides are ideal for arthritic cats, so they don't have to really step up into them, like the picture there of the kind of under the bed shoebox. They're also tend to be less expensive as well. Happiness, you know, this should be first, honestly. This is my quality of life scale. What makes them happy? And I literally have written down, I have a journal for Eli, and I monitor pretty much everything about him because I know about myself. I have an over attachment, and that can cloud my judgment. And this is something I've just learned over the years of having my judgment clouded. And the 10 things that make Eli are in there. 10 things that make Eli happy. Some of them are tennis balls. So when he has no interest in a tennis ball, that will be crossed off the list. Licking cats. He recently went through a time where he wasn't feeling well, and he goes around at night and licks all of my cats, and he wasn't doing that. And I noticed, and then when he started feeling better and licking them again, now I use that as an indicator as to how he feels. So keeping aware of those kind of indicators as well. He loves cat food. It's the only time he will misbehave and ignore me is if there's cat food around. So I know if he doesn't want cat food, we have a big problem. He likes to get into little beds too. So when his little cat bed, so when his mobility fails and he can't squeeze himself into a little bed, that's going to be crossed off the list. He loves to go in the car. He loves to be a nurse in the hospital. He likes to go around and encourage and talk to all the patients. So the day he doesn't get joy out of that will also be crossed off the list. And the one important thing I use as an everyday indicator is I've a kind of not a long driveway, but it's a little ways to the end of the driveway, and there's a pee spot he loves there. And the day he can't get to that pee spot is going to be a real significant day. So I keep a journal because I don't trust myself to be objective, and I highly recommend it as well. Quality of life. So we now have a lot of those things on the list. It's decreased the quality of life. So now we have decisions to make. And again, the financial part, don't guilt yourself into thinking I couldn't afford it, and so I had to euthanize. A lot of the times euthanasia is the best option, whether you can afford it or not. It is the important thing there. Don't feel guilty about it. Insurance is certainly an option. Health insurance, it may help. I have health insurance on one of mine. Some of the problems are, I have to put it out and then get reimbursed. So for me, that can be a financial burden. And the cost of insurance itself goes up every year. So that can also be an issue. But honestly, I was having a talk with my sister yesterday, and we were talking, and she said, would insurance change what you were going to do? So what she meant was, would I do something heroic and expensive that would improve or keep his quality of life and wouldn't be detrimental to his happiness? And the truth of the matter is, at this point, I don't think it would. And that's a different answer for everybody. But it is something to consider. I knew a very wise person who didn't have insurance but had an account, and they were smart enough to put money away every month in that account, and it was their rainy day account. And when their dog got sick, they used the money in that account that they had for their dog. So that's another really great option, and I think a smart one as well. Consult your list or your journal. I've had it for a month now, so I feel like I have some significant data there going already. Old pictures and videos help. I have a lot of old videos of Eli on the beach running, and the day that brings him no joy or he can't do it anymore is going to be kind of an important decision making factor in my life as well. Weight loss. If they're losing weight, it can be an indicator that things are failing. Ask for help. Make sure that you have people around you that will be honest with you and understand you. And if you don't, and also use your veterinarian. But if you don't, please use your veterinarian. Use your techs and your nurses and your assistants at the vet hospital. They care and they know your pets, especially if you've had a history with them. Ask questions like, what would you do if it was your pet? Every day, I appreciate when people ask me that. And honestly, I often solicit that information without being asked, particularly when I can tell they're struggling with the decision and beating themselves up over the finances. I will often just unsolicitedly say, I would do the same thing if it was my pet. And I hope that helps. And remember, in general, when we're talking about end stage disease, things are generally going to progress in a negative direction in general. So if you've made the decision to euthanize your family member, your partner, your pet, a plan needs to be made. And if you can plan ahead, that's ideal. A lot of times you can't, so you don't have that luxury. There's options. You can do it in the hospital. You can also do at-home euthanasia. I have some resources on the next page, but call your veterinarian. If they don't do at-home euthanasia, they can usually recommend somebody who will. And I found, particularly for my cats that don't like to travel, that's been kind of the best thing for me. And Marley here in this picture, she didn't like to travel either. So for her, that was the best option for her euthanasia. She was euthanized actually on that very rug, eating cat food, because she was a cat food lover as well, surrounded by the people she would allow to surround her. Is the family gathered? Does the family want to be gathered? FaceTime is an amazing thing we have now. Kids are in college. They want to be there, but they can't fly in. There's no time to wait. FaceTime is a great option. Aftercare is something that you also want to think about. A lot of places offer cremation services. Check with your state. Different states have different laws for burying your pets in your yard, if that's an option that you would like. A lot of crematoriums and places that do these pet services, they will either have your ashes returned and they'll do them individually, or they'll do them in a general cremation and you will not get the ashes back. It all depends on what makes you feel better. But these are some things to think about beforehand. It's not the greatest time to make decisions. A lot of times they'll offer a hair clipping or a paw print as well of these pets. And if you want additional for the family. So different veterinarians do euthanasia differently, but in general, it's pretty much the same philosophy. It's an overdose. So we often tend to place an IV catheter if that's possible. Again, temperament, setting, all of that depends, size of the animal. Some just use a syringe. I prefer a catheter if possible, because that allows for more movement. It's taped in and they can move a little more. So it allows for better squeezes. Sedation should be given, and if the pet needs it, if it's a pet that's anxious or stressed, I like to feed them pre-euthanasia, and that's when you can whip out the donuts and the chocolate cake and all that stuff you've kind of kept them away from. This is a issue that some people don't want to be present for the act itself. I understand that, and I would never want anybody to be emotionally damaged by the process itself. Usually it is a very calm process, but I get it. So sometimes you'll have one family member there or no family members there. I think if one family member can be present, it is calming for the pet. The other thing I just recommend from seeing it so much is to leave the collar on until after they're deceased. I think a lot of dogs particularly, they know something's going down when their collar comes off, if it doesn't often come off. And often what happens with the process itself is that 2 injections are given IV to the pet. The first one is a sedative. Sometimes it's a white liquid that looks kind of weird, but it's a pretty potent sedative and works pretty quickly. Then the veterinarian will sometimes flush a little bit of saline in between, which is just kind of looks like water going into their vein. And it just kind of pushes the first sedative into their circulation. And then the second drug that we give them is really an overdose of another sedative that actually stops their heart. Oftentimes it's pink in color, and it will make their heart stop. So usually this is an incredibly peaceful process. And like I said, I've seen a lot of animals euthanized, and they often just drift off to sleep. If they're having trouble breathing or really uncomfortable before they're euthanized, it can actually be quite therapeutic to see them feeling so much better. It actually brings the awareness of how sick they were. The vet will then listen to their heart with a stethoscope and make sure that their heart has stopped beating. Be aware that their eyes will not close. They just don't, and that's something that can be upsetting to people. So I just would like to warn you. Occasionally, these medication will make them twitch. Occasionally, they will twitch afterwards. This happens. It's not crazy, and they're not aware that it's happening. It's really just more upsetting for us. So being aware of it can often help. Sometimes they will urinate or defecate and release urine or stool. So I tend to, when it's my own at home especially, have the wee-wee pads or the diapers underneath, just so we don't make a giant mess. The process is quick, and they don't feel anything, and it's sad, but it is a good death, and I do it with my own. And it's okay to cry and have all kinds of reactions. Even at the vet hospital, we've seen it all. Don't worry, we're not judging. Even ugly crying, snot, all of those things happen. That's okay. It's a bad day and you're allowed. And we do not judge. And we grieve with you, particularly if, we've been your veterinarian for 10, 15 years. We've known your pet almost as long as you have, and have built a relationship as well. And a lot of people I've found like to tell stories about their pets. Pre and during euthanasia, we love their stories. So keep them coming, and ask questions. Never be afraid to ask any veterinarian professional questions. There is one thing I would like to mention that isn't often talked about, that I've experienced, and I know a lot of other people have experienced, and that's a sense of relief. And that also may bring some guilt. It's a lot of stress you were going through, not just making the decision, but the day-to-day care of these animals is incredibly stressful. It consumes our lives, and we don't realize it when we're going through it. We just go through it. And when they are gone, it's a sense of relief, like, oh my God, I got my life back. And that's normal, and that's okay. And shouldn't be any guilt associated with it. You see all the money and the worry and the missed vacations. If they're had behavior issues, it's a lifetime. These two animals ran my life for many, many years, and I didn't realize it until they were gone. The dog had separation anxiety, and I was not allowed to leave the house quite frequently. And that cat, George, who I spoke of earlier, was a diabetic for almost 10 years. So he required insulin twice a day, and also ran the house, and peed all over the house. But, I had to be home at 10 and 10 every day, and awake and giving him his insulin or schedule that. That's a huge burden that you just do because they're your pets. Grieving is not cut and dry like with humans. There are people that don't get it. You will find and probably have those, it's just a dog, it's just a cat people. And my best advice is to avoid those people if you can, at least in the immediate. You need to be surrounded by people who understand your grief. Support from family, from other people that that have lost dogs or cats. Again, any veterinarian professional, there are support groups, and here are some really great resources online. Again, most of these vet schools have hotlines that you can call if you need to talk to somebody. Seeking therapy is not wrong. Lap of Love is a great organization. They actually do a lot of at-home euthanasia, so you can check out their website if you're looking for an at-home vet to do euthanasia. It tends to be in general harder to leave the house when it's a dog that you've euthanized, and harder to stay at home When it's a cat, when it's a dog and you leave the house, there's questions, there's people asking, especially if they've been your partner. So just keep that in mind. And maybe in the beginning, don't push yourself, but then try to really, work on that as time goes on. Memorials, that's a great way to celebrate the life that you and your pet had together. A lot of the crematory services will offer memorials, burials. You can build a shrine in your house. I've done that as well. You can have, coffee at the local coffee shop afterwards with your dog people, and just talk about the life of your beloved pet. A couple other things I did want to bring up post euthanasia is I hate hearing after an animal's euthanized, I'm never doing this again. And I realize it's a knee-jerk reaction. I think of it as the hangover, I'll never drink again. And I've said it as well, but animals need you. They need great owners like you and great people in their lives like you. So you got to get back on it. We need you. You don't need to rush. Actually, it's not recommended to rush. The few times I've rushed into something else, it's been a bad decision for me. I was looking for the same pet I had lost, and you're never going to find it. So time to grieve is important. And things at home can get weird if you have other pets at home. Dynamics change. There's weird stuff that was happening when the pet was alive that you may not have understood until their death. There's a hierarchy that may have been going on that you didn't understand. I recently euthanized a cat that was the boss, and my other cats couldn't figure out who was going to be the boss. It was quite interesting to watch their behavior. There's also going to be, besides the missing link, there's going to be stress levels changed at home due to your stress. So think about that and consider that, especially when you're thinking of that knee-jerk reaction to go out and get another pet that looks exactly like him. The Assisi Calmer Canine may certainly help with that type of anxiety. Pheromones like Feel Away, I'm a big fan. Giving them more attention and maybe less food. I find, at least in my world, everybody gets a little fat when somebody's sick because there tends to be a lot of food around. So a little bit of diet and exercise is usually on the menu post euthanasia in my world, which helps me get up and get out as well. You're not alone. There are other people just like you that get it as well. Consider finding help before you need help, having these resources lined up. I can tell you just personally, when I'm in a state post euthanasia, I am not in the frame of mind to start seeking help. I want to pull the covers over my head and rock back and forth in bed. So if I have these resources beforehand, I'm more likely to seek them out when I need them. Like any loss, time will help. You'll find that you're thinking of them on day 1 every minute. On day 5, it may be every other minute, and it progresses from there. Remember, euthanasia is not killing. It's not giving up. It's not spending money. It's a selfless act. You're going to be suffering to relieve their suffering. And that's why I call it and think of it as the greatest gift. When it comes to time for Eli to leave me, it will really be awful for me. But for him, his suffering, hopefully he's not suffering, but whatever pain he may be feeling that I was not cognizant of, will be relieved. And that's what makes it such a selfless yet painful act. We tend to attach things to them, and that can get in the way of things. I had a cat that I lived with my mother, and my mother passed away, and the cat was 18, and I was having trouble accepting that the cat needed to be euthanized. I was attaching all kinds of stuff to this poor cat that he didn't need. So we all do it. Just try to be cognizant of it if you can. Remember, they live in the moment. And even though they're not physically with us, my dad quotes a Buddhist quote, I believe, that says, They were with you 100 ways, and now they're with you 99. And that quote, whoever I can attribute it to, really helps me get through a lot of things.